Also breaking tonight, piece of major news. A Kelly file investigation reveals that the health care safety net the president promised to tens of millions of Americans is not there. After original reporting by Forbes and research by Fox News, we have learned today that up to 93 million Americans or more could have seen their plans lose their grandfather status. That's the protection. That you can keep your plan if you like your plan, and if you have a plan that doesn't comply with Obamacare, don't worry about it because it'll be grandfathered in. Well, as it turns out, it may not be for 93+ million Americans, and the administration knew that that was the number back in 2010. In fact, on page 34,552 of the Federal Register, in the little red Federal Register, out in the summer of 2010, it reads, quote, 66% of small employer plans and 45% of large employer plans will relinquish their grandfather status by the end of 2013. So those plans may be going bye-bye. And what does that mean? Joining me now, Avik Roy. He broke this story on Forbes.com. He is also a senior fellow at the Manhattan Institute and a former health care issues advisor to the Romney presidential campaign. Avik, thank you for being here.
Pleasure to be here.
You know, the individual insurance market has been having the troubles it's been having. You know, over 10 million could get canceled. This is the employer-based market.
Right.
I mean, we're going in open enrollment in this country for many employer, plans tomorrow. People are wondering what's going to happen to their employer-based plan, and you're telling me that this same smoking gun document, as one of our contributors discussed it, goes on to talk not just about the individual market, but the employer market, and projects what?
It projects that about more than half of the people who have coverage through their employer, those plans that they're on today will be illegal come 2013, and they'll have new plans, typically plans with higher premiums, higher deductibles, a whole range of benefits they don't actually need, and narrow networks of hospitals and physicians, so narrow choices of doctors.
So it's not necessarily going to be the same as the individual market where we see mass cancellations.
It won't be as drastic. So the individual market, so to your viewers who don't understand the difference, the individual market is for people who have to shop for coverage on their own because they don't get it from their job, but it's private sector coverage. The employer-sponsored market is for people who get coverage through their job. And that's most people. So 156 million Americans get insurance through their job. 25 million shop for it on their own.
Okay, so you're talking 153 million who get employer-based coverage. And you're telling me that now the plans that they have, over half of these plans, are not going to be grandfathered in.
Right.
You're not going to fall under the, if you like your plan, you can keep it.
You're going to be
It's going to be a new ball of wax for these people too. When? When does that start?
January 1, 2014. You're going to be forced to have an Obamacare compliant plan, which may not be as amenable to the kind of insurance coverage that you wanted or needed or liked.
Now, the employer plans are not required to have all the bells and whistles that the plans in the individual market are. They don't have to have like the maternity coverage necessarily. This is what our brain room is telling me. But they do have some bells and whistles that they have to offer under Obamacare. So what does that mean for the employer insured people?
I would characterize it in a different way. Actually, the way it works is in the individual market today, there's a lot more choice, relatively speaking, in terms of how the plan can be designed. The employer-sponsored market is more heavily regulated. And so in the individual market, Obamacare creates this one-size-fits-all regime. So if you're in the individual market today, you're likely to see higher spikes in your premiums because it's less heavily regulated, relatively speaking.
Okay.
The employer-sponsored market is more heavily regulated, and so the incremental difference won't be as high. So in the employer-sponsored market, premiums might go up by 15–20% more. In the individual market, they might go up 100%, 150% for some people.
But what about the promise of, if you like your plan, you can keep it, and things aren't going to be changing, and the premiums aren't going to go up, and it's going to save you money, so you should enjoy it?
I can tell you everyone in the health policy community, left, right, or center, knew that this was a lie. The difference now is that people are getting the cancellation notices. So people can actually, journalists can go and interview people who are getting the cancellation notice. Before, we were just arguing on our blogs and in our academic papers, well, this is going to happen, but it was theoretical. Now it's real.
Well, and frankly, a lot of people who have employer-sponsored health care have been sitting back and watching the individual market, people saying, I feel for them, but I'm very glad I'm not one of them. And now what you're telling me is, not so fast, because you may not be safe either.
Absolutely, and the administration is trying to claim that the employer-sponsored market is completely unaffected by Obamacare. That's not true. That's not true. So Delta Airlines, to give one example, they've said that their costs are going to increase by $100 million next year relative to 2013. Labor unions are going nuts because their plans are going up to unsustainable levels in terms of cost. So employer-sponsored market is definitely going to be affected, and we're going to see that next year.
It's a question about whether that is the next shoe to fall. On the subject of people who are getting cancellations, who weren't expecting them, from plans they liked, not these, quote, lousy plans that